We're started.
Yep.
Okay.
So I think
He's holding up 1 minute. That's it.
I'm not gonna do something.
Just read it. Can I see them?
it's not.
If I get into Zoom here, just make sure it's muted. It's not.
It'll feedback.
I can't roll on it unless you guys.
Okay.
You can snag a picture.
Mhm.
I can get a snapshot.
You guys are up.
Okay, hello.
You might just verify that it's actually still on there.
Okay, I want to make sure that everybody is still online. Jamie Harrington,
President.
Don Gosnell,
Present.
Josie Bell,
Present.
was that a yes, Josie?
Yes, I'm here. Sorry.
Perfect. We're trying to make sure we have a quorum, and I made 4, so the lawyers are doing roll call. So thank you very much, everybody, for joining. I wanted to take a quick second to introduce Michaela Huston, who is new to the board and is sitting in throughout the meetings today to see kind of what she would like to do this next year, and to thank her for being here in her service.
Oh, thank you. It's my honor. I've enjoyed it.
Good. Okay, and was no on-site packet, correct?
That is correct.
Okay, and then any additions or revisions to the agenda?
None.
None.
that I know of.
Okay, and then announcements?
No
No
announcements.
announcements. Okay, well, we're moving right along. We're a
Got
little
everybody here.
Okay, so approval from the minutes from June 28th of 2022. Anybody have any revisions or? Get a motion to approve those?
I'll motion to approve. This is Jamie.
Oh, I'm sorry, Jill will do the motion.
Is there a committee member that would like to make the following motion? I move to approve the minutes from the June 28th, 2022 APRN committee meeting as written.
So moved. This is Jamie.
Seconded. This is Dawn.
Okay, all in favor? Say aye.
Aye.
Aye. Perfect. All right, so moved. And then we're gonna move on to the unfinished business. We'll start with prescription monitoring program committee report. Is Shannon is not on, correct?
Well, they're in the attendees. We could try letting them in again. Would you like? Sure. Okay, Colton, you can try to let Shannon. Excuse me.
They at least said something in the chat or the question and answer thing. So they should be prompted to join. It may not be working on their end.
I don't believe they have the option for a microphone or video,
Okay,
so they may not be able to.
okay, well then we'll move on. We'll move on then. Okay, update on CNM1 regulations, independent regulations.
Yeah, this is Carol Moreland, administrator. I don't know anything about this. I don't know. Jamie, do you know anything more about this?
So the only thing I know is the committee met in October, I believe, or early November. I think it was October though. And there was a lot of issues because some of the language that had supposedly gone through was not what the committee had agreed upon or voted on. And an example of that was that nurse midwives practicing needed to transport patients when they became high risk. And that doesn't really apply to nurse midwives practicing in the hospitals, which is about 90% of Kansas nurse midwives. So I'm not sure how that went through, but we need to go back and do a whole language revision, is my understanding. And so we have a meeting, I think, scheduled in January sometime.
So Jamie, this is Carol. Are you saying just for the ones that haven't been approved, there needs to be more work done, or are you talking all of them?
Well, I'm not talking all of them necessarily, but definitely the ones that were brought in front of the Board of Nursing that we saw need to be revised some. And then as well, some of the language on some of the others. And I don't know the exact numbers of those regulations, but.
Okay, because I haven't heard anything. So, okay, thank you.
Okay, well, thank you for that update, Jamie. I see Shannon, is that right?
Yes, I'm here.
Hey, do you want to give us a prescription monitoring program update?
Okay. Gotta love technology, don't you? So the last K-Trax meeting, we met in November and really just talked a lot about drug funding. The funding to continue the K-Trax programs. Specifically talked about some drugs that could be of concern outside of just the main narcotic type medications. So we're still looking at ways to make sure providers are aware of the medications and really just link the pharmacy, the pharmacists and the providers together to work together to try and help monitor some of these higher risk medications. The one thing that has come up that they wanted me to really look at and address with this committee specifically was they're looking at putting together some continuing education programs specific to K-Trax. And they have a whole slide set put together that I am reviewing for them, and wanted me to kind of get the input of the committee as far as if we think that would be valuable to have like continuing education for especially the midlife, the nurse practitioner level.
Okay, so you cut out a little bit.
Yeah.
I'm looking around the room.
Okay.
Okay, can you clarify that, please, Shannon?
Okay, can you hear me? Oh,
Keep cutting out.
do you want me to log out and log back in, or I don't know?
I think that may be on your end because I can hear him just fine.
can hear.
Oh,
I can't, yeah, we can't hear.
I can't, yeah.
I can hear on Zoom fine.
oh.
And then Jamie cut out too. So
Okay.
can you guys hear us okay?
I can hear you fine.
Shannon, can you hear us?
Yes.
You can't.
Okay.
I can
You
hear
guys can-
everybody.
No, we can hear Josie.
I'm not sure what to do. Sorry.
So Jamie can hear us. Dawn can hear us.
It might be the microphone as it picks you up. So a lot of microphones try to like lower and raise the volume to like normalize things when you start or stop talking. So it's probably just the beginning or end of that that's getting you. So if you just like keep continually talking, it should pick you up just fine.
This may be better.
And that's Shannon, right? That you're talking.
Yes.
Shannon.
Just trying to-
Shannon, if I paraphrase, since they can hear me, will that work? And then you can say whether or not I paraphrase correctly?
That's it.
Yeah.
That would be
Alternatively,
fine.
you could dial.
Okay, so again, need me to repeat that?
See, we could have her try dialing into the phone number on the meeting. Another option alternative.
Just have her dial in.
Shannon, do you want to dial in, please?
Okay,
There's a phone number on the agenda. If you could dial into that, that may work better.
okay,
It's down to the bottom of the agenda by the Zoom information.
And so the other thing we might be fighting here is the ambient noise that the room microphone's picking up. Zoom likes to also mute whoever's, like, it tries to mute whoever it thinks isn't talking. So if it picks up your white static noise is louder, it may end up silencing the person
better?
who's actually talking.
is that better?
Uh,
Is that,
I can still hear you.
okay.
It's really strange.
Okay, tell me, I don't, there's like, what phone number should I dial into? Or Josie, if you just want to paraphrase, that might.
Okay, this is what I think I heard, and I do not want to get this incorrect. But
You're fine.
you want this committee's input on creating educational content specifically that relates to K-TRAC that would be
Correct.
available on the website for nurse practitioners who are involved in that program.
Correct. And the thought is that would get more involvement with K-TRACs and, more buy-in to help utilize the program. Do we think that would be a benefit to nurse practitioners?
I'm wondering if the
I heard
better option would be for. her to
Benefit
dial.
for nurse practitioners is all I've heard.
I would highly recommend you try dialing in.
Yeah.
This is definitely on your end. I can hear them perfectly fine.
Huh.
They're louder than
Yeah.
you, actually.
We haven't had any problems.
Yeah, I can hear everybody but Shannon.
Yeah.
Do you want to send me there's several different phone numbers on the agenda.
I didn't hear any of that.
Do you have a specific phone number? She's seeing several on the agenda.
Is it the 166?
It's the one tap mobile. It's 1-669-900-6833. I believe. It's got all these other numbers too.
Yeah, they'll have the webinar ID number and the passcode too.
Any of those should work, so.
And you'll probably need the webinar ID number, and that's 897-3687-3920. And then the passcode, 974-533-3014. I'm sorry, that's a lot of numbers.
Alternatively, we could shut down the meeting and start it back up, but I don't know what happened with that.
The other thing of this maybe it does sound like she's coming through like a cell phone speaker or something. So it may just be like the quality of the mic is doing something weird on your specific speakers.
Maybe it's coming through the house and everybody else is clear. So I mean, you can hear everything.
I say audio can be fun.
Okay, can you hear me?
I can hear you, yes.
Still can't hear very well.
You still can't hear her very well?
No, not at all.
Is that via the dial-in phone number?
She sounds different, so yeah, I'd say we're on something else.
Very strange. What's the pleasure? I mean, we could reset it. And,
We gotta have her on.
you want me to?
Well, no, we don't have, because that makes fine.
If you mute on your end for a second, does that, while she's talking, does that help at all?
Yeah, go try and say something now.
Can you hear me okay on your end?
I can hear you. Yes, Jamie. Shannon,
Okay.
can you hear us?
It looks like the committee was giving a thumbs up that the audio was better. Yeah, there.
Not.
You ready?
We can only hear everybody but Shannon.
I don't think Shannon's talking right now. Shannon, are you able to unmute?
Okay, I'm on my phone. I called in.
Okay, we can hear you. Is this better for the board? No,
Huh, that's weird.
that is really weird. Jamie, I assume you can hear her just fine?
Yeah, I can hear just fine.
Okay, so this is something to do with the way the setup is in the boardroom.
Why don't we have Shannon call in and then we'll move on with the agenda going forward?
That's what
Does that sound all right to everybody?
I'd recommend, because we have.
I'm on my phone.
Yeah.
Be upstairs.
I'm on
she's
my actual,
she's
I'm
already
on
on her phone.
and it's not working.
Oh, that's her phone.
It seems like we've already tried both and it's not working.
Okay, I'm sorry, Shannon, we're gonna go ahead and move on. And we'll have your comments in March. I close sooner.
Problem with that is that I need
Okay,
to
so
get back
let's
to
go
the
on with the
K-TRAC.
agenda, National Certification Agency approval requirements.
Okay, this is Carol Moreland, and this has to do with the House Bill 2279. As you well know, on or after July 1st of 2023 is when we start the national certification requirement for anybody seeking initial application through Kansas. And then the advanced practice registered nurses whose initial license is prior to July 1st of 2023 may submit evidence of this certification upon renewal. Okay, the question that I have, the language that's in there for the initial basically says that they'll have, shall have a current advanced practice registered nurse certification in such applicant's specific role and population focus that has been granted by a national certifying organization recognized by the board and whose certification standards are approved by the board as equal or greater than the corresponding standards established by the board. That's a lot, because we don't have any criteria to approve these certification standards, these certification agencies, anything like that. We don't have anything because we've never done it. So on page 8 in your packet, this is just a suggestion. I don't know what you're exactly thinking of here, but this is taken out from National Council and how they've looked at some of these. So on the left, you would see the criteria. And then across going across is some of these national accrediting, certifying agencies. So basically, we would just need to, for every one of these, if you want to do it this way, we would have to check each of these out if you wanted to use this criteria as what you want the board to approve these. Doesn't mean we have to, but I'm telling you, we gotta have this in place by July 1st. And, you know, we lost time in September because I had this ready to bring in September. So I just need to know what you want done with this. You know, National Council is putting together a reference sheet on some of these, and I checked with Michelle there to see exactly what that reference sheet was going to say. It's basically just giving us contact information for most of these, so it's not going to do this, what they're providing to us. And another question I have for you is they also, I guess, these credentialing agencies are going to send us the name of all of their Kansas licensed APRNs that they have. Okay, well, it wasn't our plan to input all of that. It was our plan starting July 1st of 2023, as the bill says, that anybody seeking initial licensure has to have proof of this. And then anyone licensed before July 1st of 2023 would provide that information when they renewed their license. So if you're wanting something done differently than our understanding of this, we probably need to know that, because for us to input that information on what 7,000 APRNs is going to be very overwhelming, because that wasn't how we interpreted this. But I guess I just need to hear from the APRN committee here a little bit about some of these things.
I feel like the easiest thing to do, this is Jamie, if you can hear me, is just to have them submit malpractice and certification when they renew, because the renewal dates on everyone's certification is going to be different. And to keep track of that, it seems very daunting.
Yeah.
I agree. And then when I was looking over this criteria, the only thing that there said something like reevaluate periodically, there just wasn't any specific dates. But when I went down into the APR consensus, the next page down, it did have some dates in there, which were like 5 years, 3 years.
Okay.
So I just thought periodically kind of leaves it out there.
And I agree. Yeah,
If we
I
could
agree.
just kind of align to what's kind of already created, I think would be fabulous. Does anybody else have any? I 100% agree with Jamie.
Thank you. So you just want me to follow what's in the APRN consensus?
Yeah, I thought that was very well written and thought out, and does give up that periodically the timeline.
So are you wanting all this other criteria to be part of the approval? And then I didn't know if the committee was available maybe to help with some of these, going through these certifications and checking all this criteria, because some of you know these certifications very well because you have these certifications. And it's going to take a little while for somebody to sit down and go through every one of these. And I just wondered if perhaps it could be split out with some of the committee members helping with this, and then we could bring it back in March or something. That's just a suggestion.
Is it something that we just bring those programs or the certification bodies before the board like we do with APRN programs to approve? Is that kind of what you're thinking?
Yeah, I mean, we have to at some point approve these before July 1st so that we can have that like on our website or something, because it says that the board has this approved list. Okay, well, we don't have that approved list. So we're going to have to be able to place that on our website or something, so that if an APRN wants to get initially licensed, they want to know which ones our board has approved, they can go and see this list. basically.
So this is probably the same question, but if I'm CRNA and I go to this thing and National Board of Certification for the NBCRNA, I would say conditions for taking the examination are consistent. I would say, yeah, that's what the NBCRNA does. Educational requirements are consistent. I would say, yeah, that's what the NBCRNA does. Is that what you're asking?
Yeah, for each of the certifying things, we're gonna have to, if these are the criteria you want to use, we're gonna have to check all this criteria for each one of these. And if you have knowledge and you know that they do, okay, but like, I don't, because, you know, we've never worked with these before, other than NBCRNA. You know, we have required that for the RNAs, but they're the only ones who have been required. So all the rest of this, I mean, I couldn't tell you that AACN positively meets all of these. I imagine they do, but to say, yes, they do, I know that for a fact, I don't. And it's just gonna take a little bit of time to find out all this criteria for each of these. And that's why I thought maybe committee members could help with that or something.
I would definitely be willing to help with the CNM, the AMCB ones.
Okay.
And I think it is a good idea because we don't want someone who has a maybe rogue certification, like as a midwife or something that's not AMCB certified, trying to seek licensure. So I do think it's important.
And we on this committee,
I'm sorry.
on this committee, we don't have a representative from all of these 1, 2, 3, 4, 5, 6, 7 different bodies like pediatric, right? So I think I can do the NBCRNA one. I am having trouble with the examinations are evaluated for psychometric performance. What's psychometric? Is that like a skills lab?
Consistency, so that, you know, if someone was to challenge or something like that, that's what I see.
Because our national board is just a written exam. There's no, I mean, that happens in the clinical programs. But if we don't have a member on this committee that knows these specialties.
Just to kind of let you know, the committee is made up of a representative for each of the 4 roles of APRN. So we've got 1 representing nurse practitioner who's not on right now, 1 representing CRNAs, 1 representing CNS, and 1 representing the nurse midwives. Okay, but I can't tell you that we have somebody that knows each of these on the committee. I don't know, because we haven't done anything with certifications at the regulatory board before, other than the NBCRNAs. So.
And then what do you use for the NBCRNAs? Is it this type of criteria?
Yeah, I mean, a lot of this, I think what Josie was saying though, is some of this, examinations are evaluated for psychometric performance. I would imagine they've done some work on their exam, but I can't say exactly what they've done to make sure it's sound and all of that. I can't believe that it would be a national one and they wouldn't. That would surprise me. But right now for the RNAs, we go out to NBCRNA's website and you can see who's certified or who's not. So we can go out and verify that that CRNA has that certification. Okay, now, again, that was going to change just a little bit with this bill, because it will be up to the applicant to provide the information, not really the Board of Nursing to go out and get it. So that's a little bit different. We're gonna have to kind of work through this, because again, we've not had anything to do with the certifications. So there's gonna be a little bit of a learning curve here.
This is Dawn. I guess my thought is, if we approach these certification programs and said for the Kansas State Board of Nursing, we need to know what is in your material, would they not help fill in some of these blanks so that we could check through them?
That's one way, is for someone to contact them, give them the criteria and say, please let us know how you meet this criteria. I mean, that is one way. That's why I thought, I wasn't sure if maybe we could get some assistance from some of the committee members. That was just a question I had, but yeah, if this is the criteria you want to use, then they're going to have to be notified or something to make sure that they meet all this criteria. If these are the criteria that you say has to be in place for them to be approved by us.
I can do the NBCRNA one. I can reach out to them to make sure that they're good with the wording in this. But I'm not sure about the other ones of, whether I'll even be able to interpret the information that comes back from those credentialing centers. I'm afraid of making an error. I'll say, oh yeah, that matches.
I understand that, yeah. Yeah, I do.
And I can do the ANCC since that's who I'm accredited through.
Okay.
But I understand what you're meaning about the pediatric, like is that what you're, Josie?
Well, yes, like I didn't even know that there was a pediatric nursing certification board available. I have no idea what the National Certification Corporation, who they talk to. You see what I'm saying? And so, I mean, I think it's an email to the correct person for all of these boards, which is going to probably turn into 2 weeks till you find the one person within the organization that knows the answer, and kind of plucking through it that way. But yes.
I think we will have some of the contact information in that reference document that National Council is putting together as far as who would be a contact at these. Okay, but it's not going to contain all the criteria and everything. And they told me they probably would have that document to me probably by the end of this week. So I could certainly then push it out if I know who's going to cover what, I could send the contact information for that particular one to that person. And that's one way to do it.
Well, this is Dawn, and the only one I'm familiar with is AACN, so I could take ownership of those and try to find that contact. And
okay, so does anybody know anything about the American Academy of Nurse Practitioners Certification Board? I'm guessing that's a no. Okay, so I can work on that one. AACN, so what, Dawn's working on that one? Did I hear that?
correct.
Okay. And then Jamie is going to work on the midwifery certification board, correct, Jamie?
Yes.
Yes. Okay, how about ANCC? Does
That's
anybody-
me.
Melissa.
ANCC, that's me.
See, we're getting this. All right. And then Josie is going to do the NBCRNA.
Correct.
National Certification Corporation. Anybody know anything about that? Okay, I can work on that one. And the pediatric, I'm hearing that nobody really knows much about that, so I will take that one on. Okay? So thank you. I appreciate that. So just to recap, you would be looking at this criteria. I will send you out as soon as I hear from National Council who the contact people are at these. And so that would be a place to start. And then maybe if we could all bring this back in March and the APRN committee could approve it, whatever, and it could go to the board, and then we would have our approved list then that we can get on our website, ready to go by July 1st. How's that sound?
That sounds great to me. Does anybody have any objections to that?
No objections.
Okay, thank you, Dawn.
No objections.
Okay, perfect.
We might have 5 minutes.
Oh. Okay, shoot. Did that include implementation of House Bill 2279?
Yeah, the only thing
kind of?
The only thing I was gonna say about the implementation of the House bill, we've had some questions on this because the language in the bill about the malpractice insurance for initial licensure has been interpreted by us and our legal counsel to mean they have to have that to get initial licensure. This evidently is a problem for some, but it's not a problem for others. So what we've been able to do for the ones that it supposedly is a problem is we can still give them a temp. Okay, and then they will be able to start work, and then evidently they can get the malpractice insurance. But prior to them getting licensed and not being able to work, they can't get the malpractice insurance. So it's kind of this vicious circle, the way the language is. So I just wanted, I know there's been some questions about that. So that's kind of how we're handling that, is they can get a temp if they want to. The temp's good for 120 days or something like that. So that's plenty of time for them to get malpractice insurance, give us the information that we need, and then they can get their permanent license. I just wanted to update you on that.
Can I say something with that, Carol? This is Jamie.
Yeah.
So one of the issues that I've seen as a question, and maybe you've answered this, can they use their student malpractice and continue that until they're able to get their license and switch that over?
Well, I think Charles is on here and he's our legal counsel, but I guess my interpretation, and I think the rest of us, was that they needed to have malpractice insurance that would cover them as an APRN. I don't know, Charles, would their student one cover them for that?
I'd have to look into that, but I would think probably not, if they're not students any longer.
Okay. So
And
we'll
then-
check into that.
The other issue I just wanted to bring forward is this is nurse midwife specific because we have to be part of the healthcare stabilization fund. But nurse midwives are unable to find any insurance provider in the healthcare stabilization fund that will cover them for malpractice now, unless you're employed by a hospital. And so what we're running into is that nurse midwives have to be part of the Kansas Availability Fund. And that is like double the premiums because those are set by the legislature. And so you may run into issues where nurse midwives are unable to afford that premium before they have an employer.
Okay. Yeah, I don't know sure what to say to that.
Yeah, right now there's really no option. And there's also an issue for nurse midwives who are like exclusively teaching, who are not in clinical practice, because there's nothing in the bill other than if you're doing, I think, what is it, charitable healthcare or working for a federal, that exempts you from that.
Okay, this is what the bill has, because I have it in front of you. It's got 3 exceptions, okay? Practices solely in employment for which the advanced practice registered nurse is covered under the Federal Tort Claims Act or the Kansas Tort Claims Act. Number 2, practices solely as a charitable healthcare provider under KSA 756102 and amendments thereto. Or number 3 is serving on active duty in the armed forces of the United States. That's the language in the bill.
Yeah, so unfortunately, like if I were to just do my teaching job and I would still have to pay like a $16,000 a year premium. That would be pretty unrealistic. Just to keep
Well,
my.
I guess my question, and maybe Charles and I can talk about this too, because what it says is that they shall maintain malpractice insurance coverage as a condition of rendering professional clinical services. So is someone who's like providing education, is that interpreted as providing clinical services? I don't know the answer to that. So maybe that's something else to check on. I don't know.
I just know that that's been a major issue, and I'm not sure if this board can do anything about that here, but the other option, which we've had in the past, is someone had to put their license inactive, which isn't really ideal.
I would be glad to talk to Charles about this, and we can see what we can come up with about this, you know, as far as an interpretation. And then I guess bring it back in March.
Yeah.
Does that work?
Yes.
I think that this is Dawn. I would appreciate that. I think you are going to address what many APNs do have questions on are those exceptions. And because many are in education teaching roles, I appreciate this. I think this will be very helpful to clarify the exceptions and put that together. So thank you.
Yeah, thank you for looking at that.
I'm not sure what we can do, but we'll give it a try. That's pretty, the language is pretty there. Okay, so we.
Okay. So we'll have to table number 5 and the new business. And, but we have an agenda started for March. So we'll add number 5 onto the agenda for March to hopefully get that started and wrapped up before the end of July. Motion.
Yeah, I just have one question. You know, we probably spent 20 minutes or so getting people on here today. And so I think the intent of the board and everything was that we were going to do this in person. So I'm asking this question because we didn't really have Zoom set up to just bring everybody in like we've done in the past. So I guess maybe we need a little direction so that we don't do this every time. You know, if the intent is that this committee doesn't have to meet in person, then we probably just need to know that because all the other committees are meeting in person. So just to give us a little bit of direction so that we can be better prepared. Does that make sense?
Are there obstacles?
You know, it is very inconvenient to drive to Topeka. I think we have crossed that bridge of virtual, and we need to be accommodating to virtual meetings.
I know it would be really difficult for me as well, and I'm traveling internationally in March, so I'm not sure when the meeting's going to be, but that would definitely impede me coming in March.
I think if we do that, then we will want to send out panelist connections. and
Yeah.
Do some pre-testing.
We're gonna have to do this different. If we will take this to the board and we'll have to invite you differently than we did because we'll have to bring you in as panelists as we've done in the past. Because again, that was not kind of the intent today and that was part of the problem. So I apologize because I think we were thinking maybe something different than you all were thinking.
Okay, did you have anything to say, Josie, before we adjourn the meeting?
Yeah, and I don't mean to, I want to be respectful of everybody's time, but we keep putting off the 5-year legislative review. And I just want to say that at the last time we met, the CRNAs didn't want to change their language, and that is changed. And I'm not really sure how to proceed with that, whether it starts at this committee or what happens, but essentially it's pretty brief, but it follows the same language as other advanced practice RNs. The CRNA is authorized to practice as an independent as that advanced practice registered nurse to the full extent of the CRNA's training and education. The CRNA may prescribe, procure, select, order, and administer any drugs consistent with such licensees' training and education. Any drug that is a controlled substance shall be prescribed, procured, administered in accordance with the Uniform Controlled Substances Act. So that wording, we would like to replace the sentence that says we function as an interdependent role member of a physician or dentist-directed healthcare team. So.
Hey, Josie, this is Carol Moreland, and actually that is on the agenda for the board meeting tomorrow. And one of the CRNAs, I think it's Brian maybe, is going to come and present all that because they're going to be asking if the board will support that. And so that's on the board agenda for tomorrow. So
Okay, thank you. Thank you.
Welcome.
Okay, well, we've got another meeting. Thank you, everybody, for coming. We're going to
Thank
adjourn.
you. Have a wonderful holiday season. Merry Christmas.
Same. Bye.
Thank you.